Hi everyone, my name is Tsodzou. It's a pleasure for me to present to you my capstone project titled Improving Delays in Heparin Drip Titration and Anti-XA Blood Draws. My committee members are Dr. Amanda Flynn, who is my department chair, second reader, Dr. Rita Wonderlake, third reader, Dr. Karen Elliott, my mentor at the facility where this project took place. Heparin drip is a high-risk medication which, if not titrated accordingly, could result in adverse drug events like bleeding and or clot formation, unnecessary blood transfusion, hypovolemic shock, increased risk of morbidity and mortality. The institution where this project took place, there were multiple incidences where a patient went for prolonged periods of time without titration while receiving heparin drips. Some of the reasons were lack of nursing knowledge on titration protocols, failure to review the lab results on times, errors in dose calculation, lab delaying to draw the blood because the nurse may have failed to put the orders on time, or the order was not put in as a time order, or the nurse waited until when it was time to titrate before they put in the orders, but there was limited phlebotomy staff. The purpose of this project was to provide practice change educational intervention for nurses on the right order sets for anti-XA assay, when to put in the orders, how to follow up with the lab, how to advocate to make sure that the samples were collected. And the goals were to improve precise monitoring of patients on heparin drip titration, to prevent the risk of adverse drug events, improve patient outcomes, decrease cost, and decrease the risk of morbidity and mortality. The type of type of inquiry and project analysis. The pick-up question for this project was for patients on heparin drip infusion with an educational intervention for nurses on the proper use of time anti-XA assays, improve the specimen collection times for the and also the time it took for the heparin infusions to be titrated accordingly in the post-implementation compared to the pre-implementation rates. This was a quantitative exploratory design project with a retrospective chart reviews. The independent variable was nurse education. The dependent variables were timely anti-XA specimen collection time and timely drip titration. Significance of the project to nursing and nursing practice. The project incorporated the 5 patterns of knowings, which are the empirical knowing, ethical, aesthetic, personal, and emancipatory knowing. As for healthcare, it will improve patient safety, decrease cost of care. For the advanced practice nurse, is the use of evidence-based practice in caring for patients. Literature review. The Joint Commission considers heparin as a high-risk medication that requires close monitoring. Between the year 2018 and 2020, 215 sentinel events occurred. 86 were medication-related were as a result of medication-related mismanagement. Research indicates that heparin was accountable for 5 to 10% of bleeding events in hospital settings, with some cases of subtherapeutic levels causing pulmonary embolism. 10% of adverse drug events came from anticoagulants, and 40% of trauma-related deaths were associated with heparin infusion. Between 1997 to 2007, 60,000 anticoagulant-related errors occurred. 3% resulted in patients' deaths, and 2.1% of those deaths were from heparin patients that received heparin infusion. Longer infusion times without titration increased the risk of coagulation defects. Literature search review took place with the use of Maryville Library. 4 themes in the literature review were uses of unfractionated heparin drip titration protocols, and therapeutic thresholds, barriers to heparin drip titrations, complications of heparin drip titrations. Critique of literature. Some of the strengths were that all the studies involve heparin drip. Most of the studies were retrospective in nature, and all the studies involve patients in hospitalized settings with similar settings. The weakness, few articles address heparin drip titration protocols. As for the gaps, there was limited data on pediatric, malignant, and gynecologic patients. The limitations, there were variable sample sizes. Concepts and definitions, we have acute care patients, heparin drip, compliance, anti-XA, titration, bleeding, and clot formation. Theoretical framework, Lipid's model of change was incorporated in this project. It comes in 7 phases, which is diagnosing the problem, assessing the motivation and change capacity, clarification and determination of resources, alternate routes and selection of successful strategies, examining alternatives, understanding change roles and responsibilities, stabilization of intended change, and generalization and sustainability of the intended change. Methodology, the project involved an educational intervention with quantitative exploratory design. It was retrospective in nature. It involved retrospective chart review. There was no engagement of participants, and a review of medical records in the pre and post implementation phases. The target population size initially was 150, but as time went on, a total of 228 EMRs were reviewed, with 154 pre and 74 post. The project occurred over a 9-month period from January 19 to November 30, 2021, with the pre and post educational intervention phases. Adult patients aged 18 to 89 years were used for this study. There was no gender discrimination or race discrimination. Only patients who received heparin drip over 24 hours were involved in this project. Inclusion and exclusion criteria are listed here. Those for the inclusion, you have age range 18 to 89 years. They had an heparin drip order. In heparin must have infused over 24 hours. There had to be documentation of specimen collection times, results in the chat, and titration times in the chat. Exclusion, patients less than 18 or older than 89 with no heparin orders, or heparin orders with anti-XA greater than 1.1, or those with other coagulation anticoagulants ordered. The project involved the approval from 2 IRBs, and it was a retrospective chart review of EMRs for data collection, and the data was generated from these records. The educational intervention occurred in a sequence of 5 to 10 minutes from September 3rd to September 16. Heparin was flagged on the visibility boards. Unit hurdles were used as a target reminder, and I advocated for the use of specimen collection supplies on the nursing units in case nurses needed to draw the samples. I came up with an algorithm advocating for nurses to push to get the samples drawn in case there was no phlebotomy, or the phlebotomy was late, or the phlebotomy they were short staffed in the lab. Nurses could draw it or have the charge nurses draw it. Data collection tool, Excel spreadsheet was used. The key variables were independent nurse education, dependent were timely anti-XA blood draws times, and timely drip titration all recorded in minutes. As for resources and project budget, a total of $945 was the expected cost for this project. There was an approval from the institution. A written list of patients on heparin drip was provided. A private office was used, and a private computer only accessed by the order. Protection of human subjects, there was a 2 IRB review and acceptance, and there was no feasible, physical, psychological, socioeconomic, or legal risk that resulted from this project. The project followed a timeline from establishing a contract to IRB approvals, to educational intervention, to data collection, to data analysis. Findings. The study proceeded after all IRB approvals were received, and EMRs of patients who received heparin drip infusions was utilized for data collection. And I looked at order history, lab results, medication administration section, with only minimum necessary data for this project collected. Methods and evaluation. involves the instruments and procedures, variability and reliability, data quality and data accuracy, and ethical consideration, as you will see in the next slide, next few slides. For the instruments and procedures, time measured in minutes was the key instrument, and the time difference from the other set of, to specimen collection and results resolution to titration was recorded in numerical values. Before the data collection phase, multiple educational interventions had occurred. Variability and reliability. The time factor provided a clear picture of the impact of the educational intervention, and it was also easy to calculate it in minutes, and it reflected content validity and criterion reliability. Data quality and adequacy. The data was collected according to the defined characters to ensure validity. Inclusion and exclusion criteria was strictly followed. There were 428 charts with 154 pre and 74 post reviews based on the time frame when the IRB approvals came in. 2 dependent variables in the pre and post test group had a statistical power of 1.00, reflecting adequate sampling. Ethical consideration. There was no conflict of interest. The data collected was collected solely from patients who received heparin drip. All potential patient identifiers were removed. Only numerical codes were used for the extracted data. The results were presented in an aggregate form, and the ethical considerations were validated by Maryville IRB and the institution IRB. This data analysis and presentation. Descriptive statistics was used for analyzing the collected data. You can see an image here representing the pre and the post data samples. Excel spreadsheet was used to record the data. They used SPSS version 28 was used in analyzing. The collected data was tested for normal distribution using one sample Kolmogorov-Siminoff test that did not show a normal distribution. That resulted in the use of non-parametric Mann-Whitney tests for the analysis of these samples. The primary outcome was to see an improvement in the time it took to monitor heparin drips. The 2 dependent results continues. The 2 independent samples had 4 groups in total, which lacked normal distribution after using the Simogoro test, one sample Simogoro test. There was a positive median difference at an alpha value of equal to 0.05 for both groups. The Z-score for anti-XA score, the timely titration, anti-XA blood draw was minus 7.780. Below the 2-tail significance of less than 0.001. Z-score for timely drip titration was minus 6.970. Deviations below the mean with the same assumptions of significance less than 0.001. The significance for both comparisons was 0.05, which indicates that the findings were significant and that there was enough evidence that a change did occur in the pre and post implementation. This table here shows you a one sample Kolmogorov-Siminoff test that was used for normal distribution. This is the test statistics for timely anti-XA blood draw. This is the test statistics for timely heparin drip titration. Results continue. The process measure outcome indicated that the use of best practices actually improved, resulted in the positive outcomes for this project. For contextual elements, there was a student contract, 2 IRBs, and the established stakeholders. The data was collected in the form of descriptive statistics, and its use did not significantly impact the research results. The data were extracted, analyzed, and presented. Being an employee was a facilitator, having multiple stakeholders. There was no visible barrier in this project. As for missing charts, missing data, only charts that did not meet the inclusion criteria were omitted. Discussion. Titration and blood draw times improved with the educational intervention, as you will see figure 3.0 and figure 3.4. Figure 3.4 reflects the the pre and post intervention intervention images graphed for the timely anti-XA blood draws. The brown indicates that timely anti-XA blood draw after, and the blue is the pre. And you can see some differences right there. Here, figure 4.0 reflects the timely heparin drip titration, and you can see how the time decreased in the post compared to the pre. What does these findings mean? The results revealed a significant decrease in the specimen collection times and drip titration times following the intervention. With accurate dosing of heparin drip, therapeutic outcomes will likely improve, provided healthcare providers followed standardized therapeutic protocols. The project was conducted over 11 months periods, and the studies had similar and other studies with similar lengths of time with extended over a few years. In patients who receive unfractionated heparin drip in acute care settings and the timing of coagulation studies and titration interventions is crucial to enhance therapeutic outcomes and prevent the risk of adverse drug events. Some of the strengths was that I had an extensive clinical background in this topic. I had been in this field for more than 8 years. I had an excellent rapport with my leadership team and who were my key stakeholders, and that helped with everything that I was going through and supported me. Dr. Karen Elliott actually is a mentor who still follows through with this project. There were 2 IRB approvals, and as a current employee, access to EMRs was easy. Weaknesses: the lack of demographic data on the results due to no gender or race discrimination was a limitation. The age limit from 18 to 89 years was a limit. The project was restricted to 1 unit as compared to using the entire hospital. Interpretation of results: I had anticipated a decrease in time frames in the in the time frames prior to the interventions. The level of significance of both comparisons was less than 0.05, implying that these findings were significant with sufficient evidence to prove that a change did occur after the educational intervention. There was no difference between the observed and expected outcomes for this project. What does this imply to nursing practice? Increased awareness of nursing staff and the entire healthcare team on the crucial nature of high-risk medication heparin drip. They need to prioritize laboratory orders for patients who were on heparin drip. The need for adequate staffing. The need for policy to implement protocols using time anti-XA orders to monitor heparin drip. Implications for future research. Future research is recommended for patients who receive heparin infusion throughout the entire hospital and other hospitals managed by the same corporate systems, so as to compare their results and the length of observation period with a larger sample size. A deeper insight into this time anti-XA order set and implementing an algorithm with competent phlebotomy nurses who could draw blood samples would help improve adherence to heparin drip protocols. Additionally, research projects would help evaluate and provide further information on the effects of timely specimen collection and drip titration. The research projects would identify protocols that would allow time anti-XA orders and other titration assays used for heparin infusions as a standard of care for patients receiving heparin drip. Using time anti-XA orders could be more cost-effective, decrease length of time it takes for drips to be titrated, reduce the risk of adverse drug events. As for conclusion, heparin is a high-risk medication that is infused intravenously, and if not properly monitored, could cause adverse drug events. The project was conducted to determine the impact of educational intervention for nurses on precise monitoring of heparin infusions to prevent the risk of adverse drug events. It was a retrospective study was conducted for patients who receive heparin infusion on the 3rd floor of this hospital with a quantitative exploratory design for the pre- and post-test intervention. 2 dependent variables were measured. The data was collected from January 2021 through November 2021. was analyzed using descriptive statistics and SPSS. A level of significance was less than 0.05 for both comparison, indicating that a change did occur. That brings me to the end of my presentation, and I welcome any questions that you all may have. And here are my references. Thank you for your time.